The COVID-19 Delta variant is raging, causing a scary uptick in COVID cases. According to Johns Hopkins University, the U.S. is averaging nearly 20,000 new cases over the past 7 days, a 47% increase from the prior week. Vaccination data highlights a growing divide between Republican-led states and lower vaccination rates and Democratic states. Southern states have been hit especially hard since the region has some of the lowest percentages of people who have been fully vaccinated. Mississippi, Alabama, and Louisiana are at the bottom of the 50 states, with vaccination rates ranging from 28% to 32%, with Georgia, South Carolina, Arkansas, and Tennessee joining them in the bottom 10. In Tennessee, less than 38% of the population has been fully vaccinated, and 1 out of every 542 has died from COVID-19. There also has been 125 confirmed cases of the Delta variant in Tennessee thus far. Despite the data and the science, politicians in Tennessee have been critical of state health officials' messaging regarding vaccinations. Their criticism has not only caused COVID vaccine messaging to be abandoned, but also vaccine information on all diseases. The lack of vaccine information has contributed to more than 30,000 families missing vaccination during the pandemic. Joining us to discuss the political nature of Tennessee's vaccination efforts and to share her own experiences as the state's top vaccine official is Dr. Michelle Fiscus, former Tennessee top vaccine official. Dr. Fiscus, thank you for joining us. Can you just explain to our readers why you were fired from your job of trying to get people the vaccine?
Thank you so much for having me on. I wish I could tell you that. I wasn't given a reason for my firing, but what we speculate was the cause was that I circulated a memo to medical providers who were providing COVID-19 vaccines to explain to them where Tennessee's laws were around vaccinating minors in Tennessee. Tennessee is a state with a mature minor doctrine that was actually passed down from the Tennessee Supreme Court in 1987, 34 years ago, that says that children 14 to 17 years of age who are deemed to be mature enough to make the decision can receive medical care without their parents' consent. I was asked by multiple COVID-19 providers what to do if a minor were to show up requesting a COVID-19 vaccine without a parent. And so I reached out to our Office of General Counsel at Department of Health, who provided me with language, said that it was posted to the website, said it had been blessed by the governor's office, and told me that I could share that language with whomever I needed to. And so I put it into a memo, distributed that to the COVID-19 vaccine providers in the state so that they would understand where the rules were on vaccinating children. And to my surprise, there was backlash from that memo and accusations that I was trying to go around parental authority and speak directly to children about going and getting vaccinated without their parents' consent. So again, this was a memo about a law that's been in place for 34 years in the state that was directed at healthcare providers. It didn't become public until the people who disagreed with the memo made it public. This resulted in a Government Operations Committee meeting on June 16th, where some legislators actually called for the dissolution of the Tennessee State Department of Health in response to what they called reprehensible outreach to adolescents around their ability to get vaccinated against COVID-19.
I'm still, this story has had my head spinning because I don't understand the reprehensible nature of it, right? So it is a protective, vaccines are by their nature protective. I just don't get it, other than the idea that the vaccine has become so politicized that parents want every opportunity to make sure that they don't get it and their kids don't get it and don't want anybody in their family to go around them in order to get it. But to me, that just means that more people are going to die.
And that's right. This is a vaccine preventable disease at this point, and there's no reason for any other American to die from COVID-19 now that we have safe, effective, and widely available vaccines that anyone in the country can get.
So they not only did they abandon COVID vaccine outreach, they abandoned all outreach for all vaccines for all diseases. That is just, it's hard to wrap your head around that idea. What will be the health implications of that?
Yeah, you're right. So, the response of the leadership of the Department of Health after this saber rattling threats to dismantle the health department was to pull back on any outreach to adolescents around COVID-19 vaccine. That meant canceling vaccination events that were set up for adolescents, and any messaging towards adolescents or even families of adolescents. And then that very quickly devolved into a moratorium on messaging any vaccines to parents or to children. So infant immunizations, HPV immunizations, the measles, mumps, and rubella vaccines that kids need before they start school. This is back to school. Tennessee schools start back in 3 or 4 weeks, and we're behind tens of thousands of doses of early childhood vaccinations because people had trouble getting shots during the pandemic and accessing healthcare. So what this amounts to is putting children at risk for vaccine preventable diseases and their complications. And when we look at HPV, we had a 67% decrease in HPV vaccine administrations in April of 2020 compared to April of 2019. If we don't get those kids back in by messaging to them that they're missing a vaccine, which is now forbidden from the Department of Health, then we could be looking at those kids getting a preventable cancer 20, 30, 40 years down the road. And, we will probably never remember that it's a result of this
Right.
pandemic and the response of the Department of Health to refuse to allow us to message to children who need to get back
Well,
to get vaccinated.
Dr. Fiscus, unfortunately, I am out of time, but I want to thank you for your time, not only tonight, but also thank you for your service in trying to keep people safe and keep people alive. Thank you so much for joining us tonight.
Thank you.